Hi, Miss Lily Taylor. How are you doing today?
I'm doing okay. How are you?
I'm doing well. I'm doing well. I know this is your first initial appointment coming in here with us today. So, I just wanted to give you a little information before we start. Is that okay?
Mhm.
Okay. Well, first of all, I want to let you know that this is a safe place, that whatever you tell me per our confidentiality agreement, I will not, discuss with anybody at all. Everything that we discuss, unless you're telling me that you're planning on hurting yourself or somebody else, then I do have to tell somebody about that. Okay? Are
Okay.
you okay? Good. Um, so basically, what we're going to do today is your intake. We're going to go over some questions. I want to get some background information from you about what brings you in today, your past history, some, family history, medical history. Are you comfortable with divulging some of that information with me today?
Yeah, that's fine.
Okay. So, Lily, what is your date of birth?
April 19th, 1996.
Okay. And what pronouns do you prefer to use?
She, her.
Okay, I use the same, so feel free. Um, and then today is October 16th. And so, first of all, I want to ask you, was a referral made for you, or did you call in to speak with us?
Um, my doctor referred me here, my primary doctor.
Okay, okay. So give me a little information about what's going on. What made you talk to your primary care physician and get a referral to us?
For some reason, I'm just having these weird feelings. Like right now, I'm kind of nervous. I'm just kind of like fidgety. And like sometimes, depending on like something, I might feel nervous or I don't know if it's maybe anxious. I get like really sweaty and kind of like fidgety. Um, and um, I'm sorry, I'm just
No,
a little
you're
nervous
fine.
here.
You're
Um,
fine.
but so I was telling my doctor about that. So he said I may need to speak to someone like you to kind of get some help and maybe a diagnosis of what's going on with me when I'm feeling like this sometimes. It's not
Okay.
often, but well, I shouldn't say it's not often. It's not consistent, but just sometimes I get like this.
And I'm sure that's something that probably worries you a little bit, and you want to figure out why and what's causing it. How long has this been going on? When did this first start?
Um, Sometimes I felt like this when I was in school, but since I've been an adult now, I feel like it's increased since I became pregnant.
Okay. Okay. And how old is your child? Is it a boy or a girl?
Well, so far I'm 2 months pregnant, so I don't know if it's a
Okay.
boy or girl yet.
Okay, so you're just getting into the
Hmm.
pregnancy. Okay. Okay. Um, so when you're having these feelings, how long do they last and how severe are they?
Um, it just depends, like when I can get out the situation. I say like it's like that while I'm in the situation, but once I get out of it or like go home, I'm fine. It'll go away. The severity is just like kind of sweating. My stomach kind of feels a little bubbly. I can't stop moving, kind of fidgety, nervous to kind of talk and stuff. Um, Sometimes it's hard to breathe and like I kind of feel like I'm hyperventilating sometimes. Um, that's kind of the severity of it.
Okay.
If I had to rate it on a scale, I'll probably put it at a 7.
Okay.
It's
Okay.
kind of embarrassing sometimes.
It I completely understand how you can feel that way, but we're here and we're going to go through this and we're going to figure it out for you. So, and you said that this started when you were in school. Now, was that in high school or
Mm.
college?
High school.
So about what age would you say? Was it like freshman year or later on?
Yeah, freshman year. And then all throughout high school, mainly like when I had tests and quiz and stuff, I would kind of get a little fidgety like this. But since I've been pregnant, it's just been a lot more.
Okay. And so when you were a freshman in high school, you would have been what, 14?
Yes.
Okay. Okay. Um, have you, I know this is a hard question to ask sometimes, or to answer, so to speak, but have you had any history of suicidal thoughts or homicidal thoughts?
No.
No? Okay, good, good. What about any hallucinations or delusions? Have you experienced anything like that?
No.
Okay, okay, good. So the next thing I want to ask is, have you ever seen a psychiatrist or a therapist before?
No, I don't think so.
Okay, okay. Um, are you taking any type of psychiatric medication right now? Did your primary care physician prescribe you anything for your anxiety?
No, no.
Okay. He just your primary care physician just wanted you to come here first and
Mm,
talk with us. Okay. Um, have you ever been a inpatient psychiatric ward? Have you ever had to go into the hospital for inpatient because of what you're going through?
no, I don't think so.
Okay. Okay. Um, now I know you stated that you hadn't had any suicidal thoughts, but I just want to ask again, is that something you've even ever felt or, anything like that?
No, more of just like thoughts of like what am I gonna do? But not like I'm gonna kill myself. No. I'm just kinda more stressed than anything, but never like I'll take my life to get rid of it all. No.
Okay. Okay. Well, that's good to hear. I'm happy. I'm happy to hear that. Um, so right now, what I'd like to talk to you about is a little bit of your family history of any mental health disorders. Is there a family history of behavior, mood, anxiety, trauma, substance abuse or misuse, or any other disorders with your parents or siblings or even
Mhm.
grandparents?
Yeah.
Okay, so tell me a little bit more about that.
So my dad's an alcoholic. My grandpa, he uses like cocaine. So uh my grandmother, she's schizophrenic, and my mom has depression. My brother is bipolar, and my aunts, they all have like anxiety and like depression, maybe. So I guess you could say like a lot of disorders run in the family.
Okay, okay. Um, what about a history of substance abuse with yourself? Do you, currently use any drugs or alcohol to cope? Or have you used them in the past?
I do use marijuana to cope, and that kind of like that helps too. So if I'm not able to get out the situation, like I have a pen that I'll use, and that like help calm me down, and I'll be okay. And then like typically every day when I get home, I will use it then too. But I only use alcohol during like social events. So
Okay, okay. Um, so I know you mentioned using marijuana. How old were you when you first started using marijuana?
my 16.
About 16? Okay. How often were you using it when you were younger?
Not often. I didn't know how to get it. So, I would just use it, when my friends had it. So,
So more
um,
socially.
absolutely, but, like, not as social as, like, as an adult alcohol. So it was, like, really, like, one-off. So I can go, like, 4 to, like, 8 months without using it
Okay,
when I
okay,
was in high school.
okay. Now, what about now? How often would you say you're using your marijuana pen every day or every other day? Or is it, how often are you finding that you need to use it?
Uh, Sometimes, like, every day. Yeah.
Okay, okay. Um, have you ever received treatment for substance misuse?
No.
Have you ever had anything legal happen due to substance
No.
misuse? Okay, good. Okay. Now, if it's okay with you, I'd like to go into your social history. Did you grow up with both parents or just one parent in the household?
No, well, since my dad was on cocaine, he wasn't around. He wasn't allowed to like come around family and stuff. So just like my mom, and my brother, and like my aunts, like from time to time they'll move in and out of the house.
Okay. Okay. What is the your current relationship like with your family right now?
Uh, I mean, we'll talk. I don't live with them. I live by myself. Um, where I don't talk to my dad, but I talk to everyone else.
Now, do you feel like they're supportive, that they're a good support system for you, or you just kind of have, random conversations with them?
Well, I haven't really told them about like the stuff that I'm feeling and I'm going through. I just kind of go home and I just kind of deal with it myself. So they don't really know, but I'm sure if I told them, they would know because like they all have some type of disorder or something, and we all kind of try to support each other and stuff. Like with the bipolar and schizophrenia, like they'll talk about it and stuff. I just so far I was the only one that hadn't been diagnosed with something, so I was kind of enjoying that. I'm sorry to say it, but so that's why I
No,
didn't say anything yet.
I can completely understand how, you would feel, joy from not having to deal with what you've watched your family members and your loved ones deal with. So, I mean, that is a normal feeling, but I don't want you to feel bad that you're going through this, and don't feel like, oh, well, now everybody in the family is like that. So I don't want you to be hard on yourself or anything like that. Okay.
Okay.
Um, so were your parents ever married, or
Yeah, my mom told me the story that they got married, and then I guess they went to Vegas for like the honeymoon, and they both had tried cocaine. And my mom, she was able to stop doing it, but my dad, he wasn't.
okay, okay. When did they get divorced?
Um, when I was 5.
Okay. And is that the only major relationship your mother's had was with your father, or have you had a stepfather or another, or a stepmother, or, somebody significant in your life that your mom or your father has brought into the picture?
Um, well, my dad, he got married again to this lady. I didn't really like her much, but I mean, she was good for him. She tried to get him off drugs, but he didn't want to, but she wasn't very nice to me and my siblings, so that's why I didn't like her. She wasn't physically abusive, but just verbally, like she would call us names and stuff and was just really mean. So once I told my mom, we didn't have to go over there anymore.
Okay. Okay. Now, I know that you mentioned you're pregnant. Are you married or with the father?
Um, and it's really complicated. So he was living with me, and then I kicked him out because he just he I didn't like the type of person he was, and I realized that, and now I'm pregnant. So um I mean, he'll come to the visits with me, the doctor's appointments, but sometimes I don't really want him to come because he's not that nice to me sometimes. And that kind of changed once I got pregnant. That's when he started acting really different.
Okay. Okay. And I believe you stated before this is your only child.
Yes.
Okay. Okay. Um, Tell me a little bit more about your education and employment.
So I graduated from high school and then I went to college for a little bit, but then I stopped going because I was kind of feeling like how I'm feeling right now with like going to classes and the exams and stuff. And it's embarrassing. So I stopped going to college. But I do work. I work at a bank, but I work in IT, so I don't talk to people. So I'm also not very sociable. So I like jobs where I don't have to socialize because I feel like this and I don't like how I feel.
Okay, so it's hindering certain employment and educational opportunities because of
Yes.
how you're feeling. Okay.
Mhm.
Um, has there been any, family stressors recently, like a death? Or I mean, I know you're pregnant, and with your, what you're going through, I'm sure that maybe may be a stressor, or divorce, maybe. And is there anything going on that you feel is really causing you issues right now?
Um, just how, my child's father is kind of acting. That's something. Sorry, I'm just feeling this way now, but
It's okay. Take your time. If you need to
that's
take some
really
deep
it.
breaths, take some deep breaths.
That's it.
Okay. Um, is there a history of military service in your family?
I think my dad was in the military, but he had a dishonorable discharge.
Okay. Do you have a history of verbal, sexual, or physical abuse?
Like I do it or I've gotten it.
You're on the receiving end of it.
Yeah, my stepmom lady, she was verbally abusive to us.
And is that
That
also going on with your child's father?
it's kind of more emotional abuse.
Okay. I mean, that's I know that hurts just as much as verbal, abuse. Um, Describe your support system, or if there's lack of support system, and how you cope with some of the things you're dealing with right now.
Mom, well, my mom and my brother and my aunts, they help with like the pregnancy stuff and like preparing for the baby. And they help me a lot with that because I think they can sense how I'm feeling about the baby. I'm very nervous. I never wanted kids. So I, now have to teach myself how to be all motherly and stuff. And then they don't, like I said, they don't know about how I'm feeling right now, like about this. They just think it's just about the baby. So they're like overly stepping in to help with the baby stuff.
Now, do you feel that that's causing you more stress with them? Kind of like, I guess, are they kind of like hovering over you with the baby stuff? And
No, I like it because,
okay,
I don't know what to do with kids. I'm the youngest, so I've never been around a baby before. I've never seen like up close and like held a baby. I've never done all of that. So, and I don't know what to expect. So I really like it, and it's been helping me like get ready. But I'm still very, very nervous.
okay, that's completely understandable. Um, do you have any legal history or legal problems?
No,
Okay. I want to talk a little bit about your medical history. Do you have any current or past medical conditions or issues?
I had a hernia, and I had my hip. I think they like replaced my hip.
Okay, okay, that seems like a major surgery
Yeah.
that you had. Okay. Are you on any non-psychiatric medications?
I don't really know what that means, but they gave me some pain medicine for my hip surgery. And like sometimes with the weather, I'll have flare ups with my hip. So I take that medicine.
Okay, so with that would be a non-psychiatric medication. So a psychiatric medication would be something, if we felt that we needed to prescribe you something for your anxiety, or if you had presented depression or something like that. So anything that's not like that would be a non-psychiatric medicine. So okay, so you're taking some, is it like a ibuprofen? Is it um
It's
a
stronger than that.
Okay, okay, so okay. Is it, an opioid?
I think so.
Okay,
I
okay,
don't take it often, only when I feel like I can't do it. Otherwise, I'll just take a Tylenol because obviously my dad's history. I don't want to get addicted.
completely understand. When we have your next appointment, bring me the name of the medication if you can, okay?
Okay.
Other than having your hip, any other hospitalizations that you've had?
No,
No? Okay. Any history of head injury?
no.
Okay. Any allergies to medication
Yes.
or non-medication?
Non-medication. I'm allergic to grapes, peanuts, grass, like the Dove soap. I'm allergic to that too. And um, certain types of pork will bother me and will make me start to itch. Latex. Um, I'm also allergic to bee stings.
Okay, okay. Um, so I'm really glad that we've had this conversation, Lily. It was very nice to meet you. I do feel that we should schedule another appointment. Do you feel comfortable with that?
Yes,
Okay. Does this time next week work for you?
yes.
Okay, so we will meet this time next week and we'll go a little further into exactly what you're feeling, when you're feeling it, and everything like that. All right.
Okay.
All right. So it was lovely to meet you, and I will see you next week.
It was nice to meet you too, and I hope you have a great week.
Thank you.